What we did is we looked at a very large cohort of real-world patients that included over 2,500 patients, and we looked at the prescribing patterns of bortezomib. Bortezomib is a very important component of the induction therapy of myeloma. It's very effective. However, it's associated with very high numbers of peripheral neuropathy, which significantly impacts quality of life. Studies have shown that the prescribing that once weekly bortezomib is associated with less peripheral neuropathy compared to twice weekly bortezomib. So basically what we did is we were interested to see in how do physicians prescribe bortezomib during induction therapy. So we looked at this very large cohort and we looked at the frequencies of once weekly versus twice weekly bortezomib. And as known, or as expected, the frequency of once weekly bortezomib went up over time, up to 73% in 2022, which is good news. However, this also means that still about 1/4 of the patients received twice weekly bortezomib, which is, as I said, associated with high rates of side effects. So what we also found is that there are variables associated with twice weekly bortezomib versus once weekly bortezomib. For instance, Hispanic patients still receive more twice weekly compared to once weekly. So that's something to further look into in the future. But yeah, I think it's on one hand, it's good news that we are using more and more once weekly bortezomib, but on the other hand, I think it's concerning that we still use so much twice weekly bortezomib, given that the efficacy of treatment is similar, but that the side effects are much higher in the twice weekly bortezomib group.